Now for the next up, we are looking at transposition of great arteries in children. Transposition of great arteries in children. Now look at this. Normally, the aorta should be above the pulmonary artery. But in transposition, there's a change of position. Change position. Okay? So in this one, or how will I put it? No. The aorta is still above this. See. Look at this. The aorta should carry oxygenated blood, right? But for this one, the aorta is carrying what? Deoxygenated blood. Like aorta is supposed to be attached to the left side of the heart, but aorta is being attached to the right side of the heart. Pulmonary artery should be attached to the what? Right side of the heart, but here pulmonary artery is attached to the left side of the heart. You get it? So it's just a serious congenital defect where the two main arteries, they are switched. So this disrupts the normal flow of oxygenated blood and what? Deoxygenated blood. It's a life-threatening condition. Do you understand? So in normal heart, left ventricles pump oxygen, poor blood. Alright, right ventricle pumps oxygen, poor blood. Left ventricle oxygen rich. So in this transposition of great arteries, aorta arises from the right ventricle instead of the left. Okay, pulmonary artery arises from the left ventricle instead of the right. Okay, so this creates two separate and non-communicating circulating loops, which means the body doesn't receive the oxygen it needs. Can I say? You understand? So the arteries are there quite alright, but they are in different positions. There's a change of position. So symptoms is baby is not getting enough oxygen, so their body is becoming bluish, rapid breathing to compensate, poor feeding and failure to thrive, lethargy or irritability. So diagnosis is fetal echocardiogram, pulse oximetry, echocardiogram, chest x-rays, ECGs, cardiac MRIs. Okay, so treatment options is all those balloon atrial septostomy. Okay, that's treatment. So it's performed shortly after birth to create or enlarge a hole between the atria. Allows mixing of oxygen rich and oxygen poor blood to temporarily improve oxygen delivery. The atrial switch operation. You understand this one? The aorta and the pulmonary arteries are reconnected to their correct ventricles. Okay. So management of associated defects like ventricular septal defect, atrial septal defect, patent ductus arteriosus, all of this is surgical corrections. Okay. So that's it for transposition of great arteries in children.